Hello everyone, welcome to EAI International Conference on COVID-19 Risk Analysis. Myself Arun Kumar from Dr.MGR Education and Research Institute. I am the speaker of this project and author too. The co-authors are Dr. Daliya Kameshwaran, Charmati and Mithilesh. Let's see the outline of this project. Abstract, Introduction, Scope of the project, Proposed method, Architecture, Module description, Result, Conclusion, and the future work of this project. Abstract. Coronavirus disease is an infectious disease caused by the SARS virus that has been spreading worldwide. Most people infected with the virus experience severe impact to their health, finance, and many other aspects. Infected people often experience mild to moderate respiratory illness and recover without requiring any special treatment. However, some become serious illness and require timely medical interventions like older people, those who have underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer, are more like this to develop serious illness. Anyone can get sick with COVID 19 and become serious illness or die at any age. As the number of cases continues to rise, it is clear that this virus pose a threat to public health. In this work, an analysis is performed on whether an individual has been affected with coronavirus or not. This is done through an online portal where the user answers simple questions regarding to the symptoms of the diseases like cold, dry cough, loss of taste and smell, tiredness, etc. Once the given questions are answered, the user will be intimated whether he has been possibly infected with coronavirus or if the symptoms are not alarming. In case of possible infections, the applications also shows the possible level of infection so that the user can take necessary precautions before that. The user could also take subsequent measures like visiting the nearby hospital immediately or having a remote consultation with a physician. This concept is made in form of website where anyone can easily answer the questions and check their results. This method is quite flexible and an effective way of preliminary analysis that can be done anywhere at any time. Let's move on to the introduction. Introduction. In a recent past, the entire world has been affected by COVID-19 pandemic. However, the impact of the pandemic and the consequences are left differently depending on our status as individual as a member of society. While some try to adapt working online, homeschooling their children, and ordering food through Instacart or other online food delivery services, others have no choice but to be exposed to the virus while keeping the society functioning. Our different social identities and the social group we belong to determine our inclusion within a society and by that extension of vulnerability to epidemics. COVID-19 has been killing people on a large scale. As of October 10, 2020, more than 7.7 million people across every state, in the US also. And its 4 territories has been positive for COVID-19. According to the New York Times database, at least 213,876 people with the virus has been died in the US. However, these alarming numbers gives us only half of the picture. A closer look at the data by different social identities like such as class, gender, age, race, the picture of closer look and the medical history. It shows the minorities have been disproportionately affected by the pandemic. These minorities in the US are not having their right to health fulfilled. In order to reduce the impact of the virus, early detection of the virus infection is crucial. This can assist the user to the necessary precautionary measures and also to check the level of possible infections. To aid this, a website is created that can be made available for everyone to access and to check their results by answering a few questions. Scope of the project. The concept of analyzing whether the user has been affected to coronavirus or not by answering few questions regarding to the symptoms of the diseases like cold, dry cough, loss of taste, smell, tiredness, etc. through our website. The purpose of this project is to examine whether the user has been affected to coronavirus or not by answering the few questions, and the user can also check their results according to their answers. Let's see the proposed methodology of this project. The methodology used here is that to analyze whether the user has been affected to coronavirus or not by answering a few questions. Regarding the symptoms of the project, like diseases like cold, dry cough, loss of taste, smell, tiredness, etc. Once the given questions are answered by the users, will be intimated whether he has been infected with coronavirus or a normal fever, so that they need not to be panicked. It also shows the level of infection so that we can take corresponding measures. This concept is made upon form of website where anyone can answer the questions and check the results. Let's see the architecture, system architecture of this project. The admin says the questions related to COVID-19 symptoms so that the user can view these questions and respond to those questions. Based on really given the user, the risk level is calculated. After that, user will be intimated whether he has been possibly infected with coronavirus or not. Depending on the symptoms entered by the user, the risk level is also analyzed. The given guidelines to be followed for different risk level and also included. These guidelines include all precautionary measures that can be taken at home immediately. After viewing the result, the user can check their nearest to the hospital and can also check the availability of beds in the hospital. He can also dedicate to the quarantine immediately by preventing for the spread of infections. This is just an diagrammatical diagram, architect diagram, and the module description is the COVID-19 risk analysis system has several submodules, each of which has own functionality. These different modules are listed below. Admin and the users. The admin works with the sets of questions related to COVID-19 symptoms, displaying information about vaccination, advisable and video to the user, displaying precautions and guidelines to the user, displaying nearest hospital and availability of bed, and displaying the hospital addresses, contact numbers, emergency contact numbers, etc. And the users enter name and age, respond to the questions, get the risk level, view precautions and guidelines, view nearest hospital and availability of bed. The admin side will the set of questions and provide the precautions to the user, and the user can respond the questions and view the result and also check the nearby hospitals. In some test cases, software testing is a critical element of software quality, assured to the represents of ultimate reviews of specialization. Result. The main concept of the website is to check the analyze whether the user is infected with the virus or not. The web page consists of 30 questions which ask for several symptoms faced by the individual. The individual is asked to enter his or her name, age, and followed by the symptoms faced. The user is asked to answer the each and every question. After analyzing the data, the user gets the result whether the infection is low, average, high, or at an emergency situation. Some sample questions for you is like enter your name, enter your age, enter your gender, select your gender like that. What's your current body temperature? What's your saturation rate in oximeter? Do you have fever? Do you have any throat pain, cold, or cough? How long do you have those symptoms? How many members staying with you? Any of your family members or friends facing the same issues like that. Workshop. In workshop, 30 questions were given and n number of datasets were collected from different people. Individual responses to those questions were entered by the user and before submitting it. After that, an average was found as shown in figure below. Based on the user risk level can be analyzed. The table 1 below shows the workshop related data and average risk level factor uptime. Conclusion. In this work, a web page is developed for any user to enter his health details. The health condition can be analyzed by data input given by the user. After analyzing, the user receives the result on whether the infection is low, average, high, or emergency. The aid him to take necessary precautions like steps to allow also contact the nearby hospitals immediately before the viral necessary infections. The COVID-19 pandemic is spreading across to global and alarming rate. Timely identifying of the infection is the key to getting timely medical help, thereby preventing any patients like that. The system will be for all. In the near future, COVID-19 vaccine booking system can be included in the website. That will be more helpful for the people to book their vaccines easily. Another possible future work is adding pharmacy system in the website that will be help the people to purchase the medicines form of place where they can live so that they can do not have the come outside of the during pandemic. The system is surely a blessing to all the people considering the current situation and current scenario. Future work of this project is the website can be made in the form of Android application to include a pharmacy system that will help the people to purchase medicines from the place where they live. And also COVID-19 vaccine booking system can be included that will be more helpful to book their vaccines easily. That's it guys. These are the factors that we have done in our projects. Thank you for listening and thank you for EAI International Conference for giving those opportunities to us. Thank you.